Okay, let's unpack this. Every dog breeder has been there, watching your bitch's contractions weaken, the intervals getting longer, and instinctively reaching for the calcium. It's become such an automatic response, almost a knee-jerk reaction, that most of us never question whether we're actually helping or maybe making things worse. That immediate thought that more calcium is the answer to a stall of labor, it's deeply ingrained, isn't it?
Absolutely is automatic. I can vividly recall countless times, especially in my earlier years, where a slowing labor had me instinctively grabbing for that tube of calcium, convinced it was the magic bullet. It's almost like an article of faith within the breeding community. You just do it, you know?
Yeah.
Because that's what we've always been taught.
And that deeply ingrained instinct is precisely what Dr. E's latest article, provocatively titled, "Are You Using Calcium Wrong During Dog Labor?" Truly challenges. It presents a core, unsettling finding that might just flip your entire understanding of whelping on its head. The research shows most difficult births in dogs happen with completely normal calcium levels. This isn't just a minor tweak to our existing protocols. It's a fundamental reevaluation, a scientific roadmap that demands we move beyond assumption and into truly informed action.
Wow, that's a bold claim, and frankly, a bit unnerving. It directly challenges everything I and so many other breeders have been taught and practiced for years. If our go-to solution isn't actually addressing the problem, then what exactly are we doing when we reach for that tube? It really opens up a whole new line of questioning about our immediate interventions, right there on the whelping floor.
Yeah, precisely. And the uncomfortable truth Dr. E lays bare is that some of our most trusted calcium practices might actually be setting our dams up for the very problems we're trying to prevent.
Duh.
So our mission today in this deep dive is to cut through that noise, dispel those long-held myths, and give you a clear science-backed approach to calcium management during whelping. We're here to provide you with a shortcut to being truly well-informed, packed with some surprising facts that will hopefully lead to some profound aha moments, ensuring you can provide the best, most precise care for your dams and their precious puppies. Okay, get ready for a significant mindset shift here, because this is the core revelation from Dr. E's groundbreaking research, and it's where it gets, well, really interesting. For years, we've had this deep-seated instinct that a stalled labor must be about low calcium, right?
Absolutely. That's always the first thought.
But the data, the hard science, is actually telling us something completely different. The vast majority of difficult births, what veterinarians and breeders call dystocia, are not due to calcium deficiency at all. You'd think, given our ingrained habits, that it's always about the calcium. But the evidence from extensive studies points elsewhere. These difficult births are overwhelmingly the result of mechanical issues, like, say, a puppy being too large for the birth canal, or positioned incorrectly, perhaps breech or sideways. Or, just as commonly, it's due to simple uterine exhaustion, where the uterus, which is a powerful muscle, has simply worked itself out after hours of contractions. Think of it not as a car running out of fuel, but rather as the engine getting tired, or maybe something physically blocking the road.
So if it's not low calcium and we're just instinctively reaching for it, what are we actually doing? Are we wasting precious time? Because if a mechanical obstruction is the issue, or if the uterus is truly exhausted, giving more calcium isn't going to solve it.
Right.
In fact, you're delaying critical interventions. You're potentially allowing fetal distress to worsen, or putting the dam at unnecessary risk when she and her puppies need real help, perhaps a vet visit or even a C-section. It's like trying to fix a flat tire by adding more gas. It just doesn't address the fundamental problem and could make things much worse.
You've hit on a crucial point there. And Dr. E delves even further into that risk, highlighting one of the most dangerous consequences: the danger of pre-labor supplementation. This is a huge one for many breeders. For years, we've often been advised to build up her reserves by giving calcium repeatedly in the final weeks of pregnancy, thinking we're being proactive in preventing problems.
Oh yeah, that's standard advice.
But the article clearly details why this practice is actively harmful. What you're actually doing by providing calcium externally is suppressing the dam's own natural calcium regulation system. Her body, sensing this constant influx of calcium, becomes, for lack of a better word, lazy. Essentially thinks, oh, I don't need to work to pull calcium from my bones or absorb it efficiently from my food because it's always available from this supplement. This leaves her completely unprepared for the massive calcium demand of nursing, when she truly will need to mobilize huge amounts of calcium to produce milk for her litter.
That's incredibly counterintuitive for so many of us. As you said, building up reserves has been standard practice. It feels almost like neglect if you don't do it. So Dr. E is saying that if her body's natural system effectively shuts down during pregnancy, then when she hits that crucial peak milk production phase post-whelping, she's ill-equipped to meet the sudden, intense demand. You're inadvertently setting her up for the very thing you're trying to prevent, a true hypocalcemia crisis or
Yeah.
eclampsia, because her body simply can't self-regulate or access its own stores. It's a classic case of trying to prevent a problem and accidentally causing it.
It's absolutely actively harmful, according to the research presented. And compounding this, Dr. E points out a critical fact that often gets overlooked. Not all calcium products are created equal, especially when it comes to absorption during labor. This is crucial for breeders to understand for their whelping kit. Many common products like calcium carbonate, think your basic Tums, or general calcium pills you might have at home, barely work when a bitch is stressed and not eating during labor.
Why is that?
Because calcium carbonate needs stomach acid to be broken down and absorbed effectively. When a dog is in labor, stressed, panting, and certainly not focused on eating, their stomach acid production significantly drops. So you could be giving calcium, thinking you're helping, but it's largely just passing through with minimal, if any, effective absorption. It's akin to trying to hydrate a parched plant by pouring water on its leaves instead of its roots.
So, no more raiding the human medicine cabinet when things get tough on the whelping floor then. Guess my emergency stash of antacids is safe from the dogs now, for a different reason. But seriously, if her system isn't functioning optimally for digestion, what kind of calcium should we be looking for? What's going to actually work when she's stressed and her stomach acid is low?
Precisely. We need something that bypasses that digestive roadblock. And speaking of specific products, Dr. E is very clear about injectable calcium. While it can be life-saving in true emergencies, particularly calcium gluconate, it must be administered strictly only by a veterinarian with proper monitoring. This is because it carries a significant, even fatal risk of causing severe heart arrhythmias if given too fast, in incorrect doses, or without continuous cardiac monitoring. It's a powerful tool, but one that absolutely requires professional expertise, a trained eye, and specialized equipment that you simply don't have at home.
I've had terrifying stories, and this is truly critical. I knew a breeder once who, in a moment of sheer panic, tried to give an injectable calcium they had on hand from a previous emergency, and it led to a terrifying cardiac event. Luckily, they were close to their vet and got immediate help, but it was a stark, sobering reminder. It's not something to keep in your home kit, no matter how tempting it might be when you're feeling desperate and alone on the whelping floor. The risks, as you said, far outweigh any perceived benefit of having it for home use. It's definitely not a DIY project.
Absolutely. It's a life-saving drug in the right hands, but potentially fatal in the wrong ones. And this leads us to another critical concept that Dr. E stresses, the 45-minute rule. This is not a suggestion. It's presented as a vital, life-saving window for intervention. If you've given calcium, the correct oral calcium, and she's not responding within this 45-minute time frame, you need to call your vet immediately. This isn't about hoping, it's about objective, time-sensitive action.
Okay, 45 minutes. How do we define responding in that context? And does this mean we literally set a timer? Because in the heat of the moment, with all the chaos and concern, 45 minutes can feel like an eternity or just fly by completely unnoticed. What kind of progress are we looking for to know if the calcium is actually having an effect?
Responding means seeing her contractions strengthen, become more frequent and productive, or actually result in a puppy being delivered. Tangible progress. If you give calcium and 45 minutes pass with no visible improvement in her uterine activity or progress, no stronger pushes, no puppy, that's your hard stop. And yes, literally set a timer on your phone. This forces you to make a clear, objective decision in a high-stress situation. It prevents you from continually hoping and waiting, which can lead to dangerous delays for both the dam and the puppies still inside. And finally, and this is another major shift in conventional thinking, Dr. E makes it abundantly clear that the real danger for eclampsia typically peaks 1 to 3 weeks after whelping, not during labor itself.
Wait, after, not during.
Yes, typically 1 to 3 weeks after. This occurs during peak milk production, when the demand for calcium is truly at its highest to support the growing litter.
Wow. This is another massive misconception for so many breeders. We're so focused on the whelping process itself, on getting those puppies out safely, that we often breathe a sigh of relief once the last puppy is delivered and the afterbirth passes. But the true peak risk is much later, when we might be less vigilant or even think the calcium problem is completely behind us. This completely reorients our focus for monitoring the dam's health in the postpartum period. It's a marathon of care then, not just a sprint through the labor.
That's right. It truly is about understanding the entire physiological journey, the continuum of care, not just the isolated moment of birth. Now let's really dive into why good breeders, despite their best intentions and years of experience, often get calcium timing wrong. Dr. E identifies what she calls the biggest mistake, giving calcium just in case the moment labor starts. On the surface, this seems intuitive, right? If she's going into labor, maybe she'll need a little boost, a head start on calcium.
Yeah, it feels proactive, like you're getting ahead of the curve.
But the article meticulously explains that this approach completely misses how a bitch's body actually manages calcium during both birth and the subsequent intense nursing period. You're inadvertently interfering with a finely tuned, naturally optimized system.
So what is her body supposed to be doing naturally? What's the ideal scenario, the biological dance, that we might be disrupting by jumping in too soon with supplementation? Because if her body has a robust natural system, we should absolutely understand it before we try to help it, right?
Her body has a remarkable, almost elegant natural system that kicks in precisely when calcium levels naturally begin to drop during labor. As labor starts, there's a significant progesterone crash, a dramatic hormonal shift that's essentially her body hitting the go button for uterine contractions. This natural drop in progesterone, combined with the subtle dip in blood calcium that naturally occurs as labor progresses and puppies are born, acts like a critical trigger. This trigger then signals her parathyroid glands to spring into action, releasing parathyroid hormone, or PTH. PTH is like a tiny internal boss, telling her bones to release their stored calcium and instructing her gut to increase calcium absorption from her diet. It's a beautifully orchestrated, self-regulating dance designed to ensure calcium is available for both powerful uterine contractions and, critically, for the massive demands of milk production that immediately follow.
Okay, so the body has this whole plan ready to go. You mentioned a sweet spot for supplementation earlier in the introduction. Where does that fit into this natural system? Is it when her body is already trying to activate its own calcium reserves, but maybe just needs a little extra push because the demand is simply too high for her natural system alone?
Exactly. The sweet spot isn't before her system even starts working. It's after her natural mechanisms are actively engaged. And if she genuinely shows signs of needing support beyond what those natural mechanisms can provide.
Yeah.
This leads us seamlessly to the concept of when calcium backfires, which Dr. E explains with a really powerful analogy. Think of your bitch's natural calcium regulation like a muscle. You use it or you lose it.
Use it or lose it. Okay.
When she receives too much external calcium during pregnancy, her body essentially says, "Great, I don't need to work anymore. Someone else is doing the heavy lifting." It becomes complacent. This effectively shuts down or atrophies her natural calcium regulating system, and this shutdown can last for weeks, precisely when she needs it most.
So she's meant to pull calcium from her bones to meet these immense demands, but if we've been giving too much supplementally, that vital mechanism just stops working efficiently. Can you give a practical example of what that might look like for a breeder in real terms? Because that's genuinely terrifying, thinking you're doing good, but actually causing a problem that could lead to a crisis down the line.
Absolutely. Imagine a well-meaning breeder who, for weeks leading up to the due date, diligently gives a daily calcium supplement, maybe a tablet or a powder mixed into the food, believing they are fortifying her, ensuring she won't run low.
Right, standard practice for many.
They're consistently providing calcium from an external supplemental source. Her parathyroid glands, which would normally release PTH to tell the bones to release calcium, effectively say, "Why bother? We're getting plenty from external sources, no need to activate." So her bones don't release their stored calcium as they should. Then, when she hits peak milk production 1 to 3 weeks post-whelping, suddenly there's a massive, unprecedented demand for calcium for milk that far outstrips what she's getting from her diet alone.
Ah, I see where this is going.
But her muscle for mobilizing calcium from her bones is atrophied. It hasn't been exercised. Her blood calcium levels crash,
Yeah.
creating the exact eclampsia crisis you were trying to prevent by loading her up. It's a classic case of trying to fix something that isn't broken, and in doing so, inadvertently breaking it.
Wow. Okay, that makes the use it or lose it analogy really hit home.
This brings us to a crucial table Dr. E provides, meticulously outlining the critical importance of timing for calcium supplementation. This framework really encapsulates the concept that timing is everything. When you give, calcium matters more than how much you give. Let's break it down, because this is where precision truly begins. First, before labor starts. If you're giving calcium at this stage, the risk level is unequivocally high H risk.
High risk. Okay. Why? Because, as we've just thoroughly discussed, this is when the dam's natural regulatory system is suppressed. You're essentially putting her vital alarm system to sleep before the fire even starts, preventing it from activating when it's truly needed. This is the period before any signs of impending labor, when she's still just pregnant, days or weeks out from her due date.
So, to be absolutely clear, if I'm feeding my pregnant bitch a high-quality reproduction diet, I absolutely should not be adding extra calcium in those final weeks, even if she's a tiny toy breed or expecting a massive litter. That truly goes against what a lot of older breeding books and anecdotal advice teach. It's a complete shift in practice for many.
Precisely. Dr. E's article strongly advocates for a high-quality, complete, and balanced reproduction diet without additional calcium supplementation during pregnancy, unless there's a specific veterinary-diagnosed medical reason that warrants it. The diet itself should provide all she needs. Moving on to early labor signs, this stage is categorized as moderate risk for calcium supplementation.
Moderate risk. Okay. At this point, her system is starting to activate. Giving calcium here may interfere with that natural activation process, essentially confusing her body's crucial hormonal and calcium signals, potentially slowing down or weakening her natural onset of labor.
What's the practical difference between before labor and early labor signs when I'm watching my bitch? Because the early signs like nesting or panting can be quite subtle, and I wouldn't want to mistake them for pre-labor restlessness. How do I know which is which?
Excellent question. Before labor means she's still just generally pregnant, perhaps still eating normally, no overt behavioral changes signaling imminent birth, she's just pregnant. Early labor signs mean she's exhibiting those classic stage 1 labor indicators, a sustained temperature drop, often nesting intensely, panting, perhaps restless, seeking solitude, maybe shivering, but she's not yet having active pushing contractions. That's the key differentiator.
Got it. No active pushing yet.
Right. When you hit active contractions, that's categorized as low risk for calcium supplementation.
Low risk. Finally.
Okay. At this stage, her natural system is fully active. And if contractions are weakening, calcium can provide direct support to those uterine muscles. This is the potential sweet spot where it might be helpful, assuming you've ruled out other issues.
So in that scenario, if I'm watching her and she's already had a few puppies and now her pushes are starting to fizzle, becoming less effective, or the intervals are getting significantly longer, but they were strong previously, that's when a carefully timed dose of oral calcium might actually be beneficial. It's not about making them stronger than they were naturally, but supporting them when they're clearly faltering due to potentially low calcium.
Exactly. It's about providing targeted assistance when her naturally activated system might be struggling to keep up with the intense, sustained demand, not about jump-starting it from a standstill, or worse, shutting it down before it even begins. And finally, during nursing, this period has the highest benefit for calcium supplementation if needed.
Highest benefit. Okay, interesting.
This is the period of peak calcium demand, where critical support is genuinely needed. Her body is producing milk, which requires immense amounts of calcium to nourish the growing puppies. This is precisely where true eclampsia risk peaks, typically 1-3 weeks post-whelping.
So the massive shift in understanding here is that we move from worrying about calcium during the whelping process itself to being most vigilant and potentially intervening during the first few weeks of lactation. That's a huge mindset shift for many of us. This means keeping an eye on her well beyond the last puppy is delivered and the whelping box is cleaned. Our job isn't over.
Absolutely. The powerful takeaway from this section, which Dr. E drives home, is crystal clear. Timing is everything when you give calcium matters more than how much. It's a complete reevaluation of our approach, moving from a blanket strategy to a precise, scientifically informed one. Let's transition now to choosing calcium that actually works during dog whelping, because as Dr. E emphasizes, simply walking into any feed store or even your local pharmacy presents dozens of calcium options, but they are absolutely not created equal, especially for a laboring dam.
Right, you see all these bottles and tubs.
Here's the reality. When your bitch is stressed, panting, and certainly not eating during labor, her stomach acid production drops significantly. This makes a huge difference in what calcium she can actually absorb into her bloodstream for effective whelping support. If her body can't break it down and absorb it, it won't help her at all. It's just passing through.
So using Tums or leftover calcium carbonate from the medicine cabinet, which, let's be honest, is common practice for many breeders in a pinch, would be mostly ineffective then. Because if her stomach acid is low, that calcium isn't getting into her system where it's desperately needed for her uterine muscles.
You've hit it exactly. That's precisely why calcium carbonate is a very poor choice in an active labor scenario. Dr. E provides a very helpful table breaking down different calcium types, their absorption speeds, best uses, and crucial drawbacks. Let's go through them, because this is where practical preparation for your whelping kit becomes vital. First, calcium citrate. This has a relatively fast absorption speed, typically showing an effect within 30 to 60 minutes after administration. Its best use is for emergency whelping support, when you need a relatively quick boost for faltering contractions. The main drawback is that it can often be more expensive than other forms, and sometimes less readily available in a dedicated gel or paste format, specifically for dogs.
Okay, so for a breeder on the floor, if I suspect calcium deficiency is genuinely causing weak contractions, calcium citrate is a good option to have on hand for that faster action, provided I can find it in the right format.
Yes, a good option if it's the fast-acting type, often found in gels. Next, calcium lactate. This also falls into the fast-absorbing category, typically working within 30 to 60 minutes, making it suitable for active labor situations. Its main drawback is often limited availability compared to other types. It's not as commonly found in breeder-specific products.
Yeah.
Both citrate and lactate are generally good for quicker uptake compared to carbonate.
So similar time frame to citrate, just maybe harder to source.
Correct. Then we have multi-salt gels. These are specifically highlighted by Dr. E as having fast absorption through multiple pathways. This is actually Dr. E's first choice and recommendation for your whelping kit. The drawback is typically a slightly higher cost, but it's presented as an investment in effectiveness.
Okay, this sounds like the winner. Dr. E recommends these fast-absorbing calcium gels or pastes as the top choice for whelping kits. Why are these multi-salt gels better than just a single type like citrate or lactate? What does multiple pathways for absorption actually mean, practically speaking, when a bitch is in labor and stressed out?
Great question. Multi-salt refers to them containing various forms of calcium, not just one single type. Think of it like this. Your dog's gut has different gates or mechanisms for absorbing calcium. By having multiple forms of calcium salt in one gel, perhaps citrate, lactate, and gluconate, for example, you increase the likelihood of efficient absorption because each might utilize a slightly different pathway.
Ah, okay. Hedging your bets, absorption-wise.
Exactly. This is especially advantageous under the suboptimal conditions of a stressed, laboring bitch where one absorption pathway might be less efficient due to low stomach acid or stress. It's like having multiple keys for different locks one is bound to work effectively and quickly. It maximizes the chances of getting the calcium into her system quickly and efficiently when you need it most.
That makes a lot of sense. So it's worth the potentially higher cost for that reliability.
That's the argument presented. Then there's calcium carbonate. This is, as we mentioned, a slow-absorbing form because it critically needs sufficient stomach acid to work, making it primarily useful for long-term daily maintenance supplementation when digestion is normal. Its major drawback in a labor scenario is precisely its poor absorption when the bitch is stressed, panting, and not eating. So those Tums we just discussed are unequivocally out for active labor. They're simply not going to do what you need them to do quickly enough, if at all.
Right.
Keep the Tums for yourself, maybe. Finally, injectable gluconate. This has immediate absorption, often working within minutes, which is why it's so powerful in emergencies. As we stressed earlier, its best use is for veterinary emergencies only, because it's inherently dangerous without proper monitoring due to the risk of fatal heart rhythms. This is why Dr. E reiterates that you should never attempt this at home under any circumstances. The article truly drives home the foundational principle here. Choose your calcium based on when you need it to work, not just what's available.
Preparation is key then, stocking the right product beforehand.
Absolutely. Now let's talk about actually reading the signs. Not every slow labor needs calcium, and misinterpreting the signs can lead to dangerous delays. The key, as Dr. E points out, is recognizing when weak contractions are actually about calcium versus other problems that no amount of supplementation will fix. Remember, the uterus is a muscle, and like any muscle, it needs calcium to contract effectively. So it's often the first place you'll see problems when calcium levels drop, even before she shows any neurological signs like tremors or muscle stiffness. The uterus is sensitive.
Okay, so what are those uterine signs?
True calcium-responsive signs during dog whelping include contractions getting progressively weaker rather than stronger or more productive. You might also notice significantly longer gaps between puppies, specifically more than 2 to 4 hours, especially if you know there are still more puppies inside. She might exhibit all the early labor signs: panting, nesting, restlessness, seeking solitude, but simply be unable to progress into active, pushing contractions. And sometimes it's just excessive panting, restlessness, or seeming anxious without any obvious external cause, which can be subtle early indicators of her discomfort from low calcium. These subtle signs can often precede a full-blown hypocalcemic crisis or eclampsia.
So if she's pushing well with strong productive contractions, then suddenly those pushes just fizzle out, becoming weak and ineffective. That's a key indicator of potential calcium deficiency. What about the difference between just being genuinely tired from a long labor and actually being calcium deficient? Because a long labor can make any bitch utterly exhausted. How do you tell those apart?
That's a crucial distinction, and Dr. E addresses it directly later in the article when discussing uterine exhaustion. But yes, if strong, productive pushes suddenly lose their strength and become ineffective, that's a classic sign pointing towards potential calcium deficiency. Tiredness might manifest as less frequent contractions where she needs a rest, but if she does push, it's still with force and purpose. With calcium deficiency, however, the muscle itself is simply unable to contract with power. It's a fundamental difference in the quality of the contraction, not just the frequency.
Quality versus frequency, got it.
Crucially, however, certain signs indicate that this is not a calcium-responsive problem and requires immediate veterinary attention, regardless of how much oral calcium you've given or are considering.
Okay, the call the vet now signs.
Yes. If she's having strong, regular, productive-looking pushing for more than 30 minutes without a puppy being delivered, that strongly suggests a mechanical obstruction. The puppy is physically stuck. No amount of calcium will help that. It needs manual or surgical intervention. Green or black discharge from her vulva means the placenta has separated. This is an urgent, life-threatening situation for the remaining puppies, as their oxygen supply is compromised. Get to the vet now, W. If she seems systemically sick, becomes unresponsive, or if you can see a puppy but it's not progressing despite her efforts, calcium won't solve these problems. These are dire emergencies demanding immediate professional intervention.
This is where breeders often panic or hesitate, and I've seen it happen. Can you re-emphasize why calling the vet immediately for these specific signs is non-negotiable? Because those are moments where every minute truly counts, and delaying can have irreversible consequences. People need to understand the urgency.
It's non-negotiable because those specific signs indicate a problem that often requires surgical intervention, specialized medical equipment, or immediate stabilization that only a veterinarian can provide. A green or black discharge means immediate fetal distress. Literally, the oxygen supply to the puppies is compromised, and you have minutes, not hours, to act before irreversible damage or death occurs. Prolonged straining without a puppy means obstruction, and the longer the puppy is stuck in the birth canal, the higher the risk of stillbirth, severe damage to the dam's reproductive tract, or escalating infection. Delaying care in these scenarios can lead to irreversible consequences, and it's a moment where a breeder's quick, decisive action to call for professional help is truly life-saving. There's no time to waste hoping it resolves on its own.
Okay, message received loud and clear. Don't wait on those signs.
Now let's look at tailoring your calcium strategy by risk factors, because a one-size-fits-all approach is another mistake Dr. E cautions against. The article provides a remarkably helpful table here, illustrating that the risk levels for eclampsia and general whelping difficulties vary greatly by breed and the expected size of the litter relative to the dam.
Ah, so it's not just about breed, but litter size relative to the mom.
Exactly. At the highest risk level, you have breeds like Chihuahuas, Toy Poodles, and Malteses. The key indicator here isn't just their tiny size, but a litter where the individual puppies are expected to be relatively large for the dam, often less than 1.5 kilograms of dam body weight per puppy.
Less than 1.5 kilograms of mom per puppy. Wow, that's specific.
It is. For these breeds, the approach should be to proactively discuss a detailed prevention plan with your veterinarian before labor even starts. These tiny dams with relatively large litters for their body size are under immense calcium stress, not just during labor, but especially during the post-whelping lactation period.
How would I apply that KEG per puppy metric in real time on the whelping floor? Is that something I'm calculating pre-whelping based on estimates? Or is it more of a guideline? Because it's hard to know exactly how much each puppy weighs before they're born, of course.
It's definitely more of a guideline, used in conjunction with your knowledge of the breed and your estimated litter size from ultrasound or palpation. For instance, if you have a 3-kilogram Chihuahua and your vet estimates she's expecting 4 puppies, that's only 0.75 kilograms of dam per puppy, placing her squarely in that high-risk category. You're using estimates based on average breed weights and expected litter size for that dam. For these highest-risk dams, a proactive, customized discussion with your vet about their specific needs, potentially including earlier precise oral calcium intervention during labor or even post-whelping protocols, is absolutely critical. It's about being prepared before the first contraction.
So planning ahead with the vet is paramount for these little guys.
Absolutely. Moving to moderate risk, we see breeds like Cocker Spaniels, Beagles, or Border Collies. Here, the key indicator is generally 1.5 to 3.0 kilograms of dam body weight per puppy. For these breeds, the approach is to monitor closely and use oral calcium if truly needed, based on the specific signs of calcium deficiency we've discussed. This is where that 45-minute rule really becomes your guiding light for intervention. It's a standard, vigilant approach.
So watch carefully, intervene if necessary, follow the 45-minute rule. Standard procedure.
Correct. Finally, at the lower risk level, you have breeds like Labradors, Golden Retrievers, or German Shepherds, where the puppies are typically greater than 3.0 kilograms of dam body weight per puppy.
The bigger breeds, generally.
Yes. For these larger breeds, the focus should largely be on providing proper nutrition throughout pregnancy and lactation, and looking for other causes if labor stalls, rather than defaulting immediately to calcium. Mechanical issues like a stuck puppy or uterine exhaustion are often more likely culprits than a primary calcium deficiency in these robust breeds.
So, for labs and Goldens, if labor stalls, think stuck puppy or tired uterus before jumping to low calcium.
That's the suggestion based on risk profile. Of course, calcium could still be an issue, but other causes are statistically more probable. It's not just about her overall size, but her size in relation to the size and number of puppies she's carrying. That's a vital, nuanced distinction.
It really means tailoring your calcium strategy based on real assessed risk factors, not just a generic breed size classification. This kind of precise risk assessment allows for a much more targeted and ultimately effective approach to whelping management.
Absolutely. It's about precision management, moving away from guesswork and tradition towards informed care. Okay, let's delve into the 7 critical calcium mistakes Dr. E meticulously outlines in dog whelping. These are the pitfalls, the common missteps that breeders often make, even with the best intentions. Starting with a really common one. Mistake number 1, loading up during pregnancy. We touched on this earlier, but it bears repeating with emphasis because it's such a deeply ingrained practice.
Yeah, the build up her reserves idea.
Exactly. What many breeders do wrong is giving extra calcium in the last few weeks to build up her reserves. This seemingly logical, proactive action, unfortunately, actually suppresses her natural calcium system right when she'll need it most during nursing. Instead, the unequivocal advice presented is to feed a high-quality reproduction diet without any additional calcium supplementation during pregnancy. Let the diet do the work.
This feels like turning decades of conventional wisdom on its head. I vividly remember my mentors insisting on calcium supplementation during the final trimester almost religiously. How do we convince breeders who've always done this, who've seen generations of dogs whelp this way, that it's actually detrimental? And what's the precise role of a balanced, high-quality diet versus external supplementation here? How does the diet cover it?
You've hit on the core challenge, haven't you? It's about respecting the wisdom of those who came before us, who do the best they could with the knowledge available, while also embracing the powerful new insights science now offers. It's not about saying you were wrong, but now we know even more and we could do even better. The key understanding is that a complete and balanced diet formulated specifically for reproduction, for both gestation and lactation, already provides all the calcium she needs in the correct physiological ratios with other minerals like phosphorus.
Ah, the ratios matter too.
Critically, this diet ensures her natural system isn't overwhelmed or suppressed. Dr. E's article even references specific recommended diets for gestation and lactation for different sizes, available through professional programs in the USA and Canada. The balanced diet is a comprehensive supplement, providing what's needed without additional, potentially harmful external calcium disrupting that balance.
So trust the food, basically, if it's the right food.
If it's formulated for reproduction, yes. Mistake number 2, grabbing whatever calcium is handy. We discussed this too, but it's so common it needs re-emphasizing. Many breeders unfortunately reach for Tums or human calcium supplements, or just whatever calcium product is readily available in the house during labor. But, as we covered, calcium carbonate needs stomach acid to work efficiently, and stressed, non-eating bitches simply don't have enough stomach acid for effective absorption. The crucial takeaway here is that an unprepared whelping kit is a compromised whelping kit. You need to keep a fast-acting multi-salt gel specifically designed for whelping emergencies readily accessible.
So this absolutely means a dedicated whelping kit with the right type of calcium, specifically the fast-absorbing multi-salt gels, is essential, not just grabbing something off the kitchen shelf in a moment of panic. It sounds like preparation, specifically with the correct tools, is key to avoiding this very common mistake. Plan ahead.
Absolutely. Just like you wouldn't use a wrench when you clearly need a screwdriver, you need the right calcium for the specific job at hand under the specific conditions of labor. Mistake number 3, trying injectable calcium at home. This is another critical safety point that simply cannot be overstressed. Some breeders, in an effort to be prepared, might acquire calcium gluconate injections just in case. But this is incredibly risky. This drug can cause fatal heart rhythms if given too fast, in incorrect doses, or without continuous cardiac monitoring. Dr. E stresses using oral calcium for home administration, reserving injectable forms for veterinary clinics only where proper monitoring and immediate emergency care can be performed if needed.
This is one of those know your limits moments, isn't it? Even if you've seen a vet do it, or if you yourself have a medical background, canine physiology and the precise delivery method for such a critical drug are completely different. It's not a DIY project, and attempting it at home is putting your dog's life at extreme, unnecessary risk. It's a specialized medical procedure, plain and simple. Don't do it.
Precisely. It's a highly specialized medical procedure. Leave it to the pros. Mistake number 4, giving oxytocin before calcium. This is a very common sequence error, and it's crucial to understand why it's a mistake. Trying oxytocin when contractions weaken before addressing potential calcium deficiency is like hitting the gas pedal with an empty fuel tank. The signal to contract is there from the oxytocin, but she lacks the actual fuel calcium to do it.
Oh, okay. The fuel tank analogy makes sense.
The uterus needs calcium to contract effectively to actually respond to the oxytocin. The correct sequence, as advocated by Dr. E, is to give calcium first, wait 30 to 45 minutes to see if contractions improve, and then consider veterinary consultation for oxytocin if there's still no effective response.
Breeders, myself included in the past, often reach for oxytocin first, hoping to speed things along, to get things moving. It feels like the more direct approach sometimes. So if the calcium isn't there, the uterus simply won't respond effectively to the oxytocin, and you're just putting the bitch through unnecessary stress, potentially causing more harm than good by overstimulating a calcium-deficient uterus that can't respond productively.
Exactly. You're essentially forcing a muscle to work without the necessary energy, which can be counterproductive, exhausting, and even dangerous, potentially leading to uterine fatigue or even rupture if pushed too hard without proper support. Calcium first, assess, then maybe oxytocin with vet guidance. Mistake number 5, stopping after the last puppy. Many breeders, understandably, put the calcium away once whelping is done, assuming the crisis is over and they can finally relax.
Yeah, you think, phew, that's done.
But, as we discussed earlier, peak calcium demand is overwhelmingly during nursing, not during the birth itself. Now, for most bitches eating a complete and balanced diet formulated specifically for lactation, no additional calcium supplementation is actually needed during nursing. The food should cover it. However, this is a nuanced point and a vital one. You must consult your veterinarian about continuing calcium throughout nursing for high-risk cases like tiny toy breeds, those with exceptionally large litters, or any bitch with a documented history of eclampsia. These specific situations may warrant additional support beyond proper nutrition alone.
So we essentially shift our vigilance from the immediate labor process to the first few weeks of nursing, especially for those high-risk dams. What are some specific signs we should be looking for then that might indicate eclampsia is developing? Beyond just basic calcium monitoring, how would we know?
That's a great question, and critical for early intervention during that peak risk period. You'd be looking for subtle changes first. Perhaps restlessness, increased nervousness, excessive panting even when cool, increased thirst, whining, pacing, or a stiff, awkward gait. She just seems off, maybe a bit agitated or uncomfortable.
Subtle stuff, okay.
As it progresses, you might see muscle tremors, especially noticeable in the face or legs, followed by difficulty standing, staggering, and eventually, if left untreated, full-blown seizures. Recognizing those early, often subtle signs is absolutely crucial for high-risk dams, as prompt veterinary intervention can be life-saving. Don't wait for seizures.
Got it. Watch for restlessness, panting, stiffness, tremors, early signs.
Yes. Mistake number 6, waiting too long to call for help. This is where human emotion, the desire to handle it yourself, the hope that things will just turn around, can really get in the way of good judgment. Continuing to give calcium or waiting around hoping things will improve risks missing mechanical problems, severe fetal distress, or underlying infections that need immediate veterinary care and cannot be solved at home. Dr. E re-emphasizes the 45-minute rule as a hard line. If she's not responding to oral calcium within this time frame, or if she's straining unproductively for over an hour, call your vet immediately. No hesitation, no second guessing. Time is critical.
This means having your vet's number on speed dial, making sure they're aware of your breeding plans and due dates, and not second-guessing that 45-minute mark. It's about empowering ourselves to make that decisive call, knowing we've done what we can at home, and now it's time for professional intervention without dangerous delay. This is where informed action truly saves lives and prevents suffering.
Absolutely. It's an act of responsible, compassionate breeding. And finally, mistake number 7, one-size-fits-all approach. Using the same calcium protocol for all dogs, regardless of their size, breed, or litter size, completely ignores the well-established fact that small breeds, especially toy breeds, face dramatically higher eclampsia risk due to their smaller body mass supporting proportionally larger litters.
Right, the risk isn't uniform across all breeds.
Exactly. Chihuahuas, toy poodles, and mini pinschers consistently top that list. Therefore, a tailored, individualized approach is essential. Toy breeds with big litters often need calcium started earlier and continued throughout nursing, but always under strict veterinary guidance. Medium breeds with normal litters require standard monitoring with calcium given only if truly needed and indicated. Larger breeds, particularly those with smaller litters, generally need a more conservative approach, focusing on other causes first if labor stalls, as calcium deficiency is less likely to be the primary issue.
So, a breeder with multiple breeds, like a Shih Tzu and a Labrador, really needs to have different specific plans for each, not just one general calcium guideline for the entire kennel. This really drills down into precision management, doesn't it? Understanding the individual dam, her breed, and her specific litter is paramount to optimal care.
Exactly. It's about being prepared with a nuanced, evidence-based strategy rather than a generic, often ineffective blanket approach. Know your dog, know her risks. Let's now discuss when calcium simply won't fix the problem during dog whelping. Understanding these scenarios is just as crucial as knowing when to use calcium, because misidentifying the cause prevents dangerous delays in getting the right kind of help. Recent studies, as Dr. E points out, consistently confirm that the majority of difficult births happen with completely normal calcium levels, meaning something else is fundamentally wrong.
Right, back to that core point, it's usually not the calcium.
Exactly. First, we have mechanical problems. Calcium won't help if there's a physical obstruction preventing the puppy from passing. This commonly includes puppies that are simply too big for the dam's birth canal, a particular issue in brachycephalic or flat-faced breeds, which often have proportionally larger heads. It could also be a malpositioning, a puppy presenting breech, tail first sideways, or with its head bent back, preventing proper passage through the pelvic canal. Another mechanical issue can be previous C-section scarring on the uterus, which can limit the uterus's ability to contract effectively around that scar tissue. The major red flag here is strong, regular, productive-looking contractions for more than 30 minutes without any progress. She's pushing hard, her body is working, but nothing is moving forward. Okay, so strong pushing, no puppy equals likely mechanical issue. How can I tell the difference between that and weak contractions due to low calcium again? Is it purely the quality of the contraction? If she's pushing with strength and effort but just no puppy, that's fundamentally different than weak, ineffective pushes, right? Precisely. That's a very keen and absolutely vital observation. With a mechanical issue, you almost always see strong, vigorous, effective-looking pushing efforts. She's trying hard, her abdominal muscles are contracting powerfully, but the puppy just isn't moving. That's your clear clue that something is physically blocking the way. With calcium deficiency, however, the contractions themselves are weak or ineffective from the outset, or they gradually become so. She might try to push, but the actual power, the muscular force, just isn't there because the uterine muscle lacks the calcium it needs to contract powerfully. It's a fundamental difference in the nature of the effort. Strong but stuck versus weak and fizzling.
Got it. Strong versus weak effort is the key differentiator there.
This leads us directly to distinguishing uterine exhaustion from calcium deficiency, which is a crucial diagnostic step on the whelping floor. Exhaustion typically starts with strong, effective contractions that gradually get weaker and less frequent after hours of intense work. She's simply worn out from the prolonged effort. Calcium deficiency, on the other hand, often presents with weak contractions from the beginning that never really get strong, or they become weak relatively early in the labor process before she's had sufficient time to become truly exhausted. The onset and quality of the weakness are your primary clues. Did it start strong and fade, or was it weak from the get-go?
That's a vital distinction. It really changes the entire approach if you're recognizing that difference. One might respond to a calcium boost if it's deficiency. The other requires rest, supportive fluids, or even surgical intervention if it's too severe or prolonged to safely continue labor.
It's exactly. Knowing that difference dictates your immediate next move and can save precious time. Beyond mechanical issues and exhaustion, there are also various medical problems requiring veterinary care that calcium simply won't address. These include uterine infection, where the bitch might seem generally sick, have a fever, or exhibit abnormal, foul-smelling discharge. Systemic illnesses like uncontrolled diabetes or pre-existing heart problems can profoundly affect a dam's ability to labor effectively and respond to stimulation. And sometimes it's other complex hormone imbalances that calcium simply can't fix. Understanding comprehensive pre-whelping health monitoring helps identify these conditions early, long before labor even begins, so you're not caught off guard by a surprise illness during this critical time.
This really underscores the importance of a thorough pre-breeding workup, meticulous prenatal care, and open, ongoing communication with your vet throughout the entire pregnancy. It's not just about labor, it's about her overall health and identifying potential complications before they become full-blown crises. So much depends on that foundation.
Absolutely, it's holistic proactive care. Now let's look at the practical protocols Dr. E outlines for calcium use, because having a clear plan reduces panic and increases effectiveness. We'll start with standard whelping support. The protocol is clear. Start only once you confirm stage I labor. That means you've observed a sustained temperature drop of more than 0.6 degrees C, 1 degrees aft, from her normal baseline, typically accompanied by classic stage 1 behaviors like nesting, panting, and restlessness. If she's not in confirmed labor, you wait. You do not give calcium just in case.
Right. Wait for confirmation.
Once labor is unequivocally confirmed, and if contractions are weakening, you give a fast-acting oral calcium gel, specifically adjusted for her size. You can repeat this dose between puppies if the intervals get longer or contractions visibly weaken. Critically, if there's no visible improvement in 30 to 45 minutes after administering the calcium, you contact your veterinarian immediately. That's your hard stop for at-home management.
So, once confirmed stage I and I see weakening, how do I know how much of the oral calcium gel to give? Is there a general guideline, or is it always strictly size adjusted? Because a tiny Chihuahua needs far less than a hefty Great Dane, obviously.
It's always size adjusted, and the precise dosage will depend on the specific multi-salt calcium gel product you have on hand, as their concentrations vary. Dr. E's article implicitly suggests referring to your chosen product's instructions, or, ideally, discussing exact dosages with your vet beforehand to have a pre-approved plan for your specific dam's estimated weight and risk profile. The principle is clear. Scale it appropriately to her body weight and the product's concentration. Don't guess.
Okay, follow product directions or get vet advice on dosage beforehand. Makes sense.
Now for high-risk management, and this applies specifically to toy breeds, those with exceptionally large litters, any bitch with a previous eclampsia history, or those with a very low body weight to litter ratio, less than 1.5 kilograms of dam per kilogram of estimated puppy weight, the approach is slightly different and more proactive.
Is it little guys again?
Yes. Again, before whelping, provide a high-quality reproduction diet with no extra calcium during pregnancy. During labor, you would intervene earlier with oral calcium at the very first signs of weakening contractions or protracted labor, given their increased susceptibility. However, that strict 45-minute vet call rule still applies if there's no clear, positive response. Don't wait longer just because they're high risk. This is key. After whelping, you absolutely must have a detailed discussion with your veterinarian about whether additional calcium support is needed throughout the nursing period for these high-risk cases. While most bitches on proper lactation diets won't require supplementation, these specific dams are often the exception and may well need it.
It sounds like a proactive conversation with your vet before labor even begins is absolutely crucial for these high-risk dams, so you have a pre-approved, tailored plan in place. And then, that ongoing dialogue and vigilant monitoring after whelping is just as important as the labor itself. It's continuous care.
Exactly. Pre-planning, continuous assessment, and close veterinary partnership are keys to success and preventing emergencies in these cases. Lastly, for emergency situations, true eclampsia, characterized by severe tremors, muscle stiffness, inability to stand, or full-blown seizures, needs immediate veterinary care with intravenous calcium. This is absolutely not something to manage at home. It's a life-threatening crisis requiring immediate aggressive treatment.
Straight to the vet. No messing around.
Absolutely. Similarly, severe labor problems not responding to oral calcium within that 45-minute window, or exhibiting any of those immediate vet red flags we discussed earlier, like green discharge or prolonged unproductive straining, require professional evaluation without delay, which might lead to oxytocin administration, or, if necessary, surgical intervention like a C-section.
This is where the time is tissue principle really applies, isn't it? No amount of at-home support is going to fix a true emergency like full-blown eclampsia or a prolonged mechanical obstruction. It's about knowing when to escalate and trusting the professionals to provide that critical, life-saving intervention.
Precisely. Recognizing those moments saves lives, quite literally. You have to know when you're out of your depth. Let's distill all this incredibly valuable information into simple, systematic decision-making for calcium during dog whelping, as outlined by Dr. E. It really comes down to a clear, step-by-step approach that removes guesswork in stressful moments. First, you start by confirming she's in actual labor. Look for that sustained temperature drop, consistent nesting behaviors, and active panting. If she's not in confirmed labor, you wait. You do not give calcium.
Step 1. Confirm labor. Got it.
Once labor is confirmed, you then assess her contractions. Are they weak or getting weaker and less productive? Or are they strong and progressing normally, leading to puppies? If contractions are strong and she's progressing, you simply monitor her closely without calcium. It's likely not needed at that point.
Step 2. Assess contractions, strong or weak.
Right. If contractions are weak or clearly weakening, you give the appropriate fast-acting oral calcium and immediately set a 45-minute timer.
Step 3. If weak, give calcium start timer.
If you see visible improvement within this window, contractions strengthening, becoming more productive, or a puppy delivered, you continue monitoring and can repeat calcium between puppies if needed, following guidelines.
Okay, assess response within 45 minutes.
But if there's no improvement after that 45 minutes, you call your veterinarian immediately. That situation unequivocally demands professional assessment. No more waiting.
Step 4. No improvement in 45 minutes. Call the vet.
That's the core decision tree. This systematic approach to monitoring labor progress ensures you're making the right, most timely decisions.
So if I'm there in the middle of the night, perhaps sleep-deprived and certainly stressed, that's my mental checklist based on this. Is she in labor? Yes. Are contractions strong? No, they're weakening. Okay, give the fast-acting calcium, set a 45-minute timer, check again in 45. No better. Call.
That's precisely the simplified, actionable thought process you want to internalize for those moments. It keeps you focused and objective. Simultaneously, and this is non-negotiable, you must always be watching for the critical emergency signs that require immediate veterinary care, regardless of calcium response. These are your absolute red flags. Green or black vaginal discharge, prolonged straining, meaning over 30 minutes of strong, unproductive pushes, or over an hour of any unproductive straining, tremors, or collapse.
And those override the 45-minute rule, right? You see those, you call immediately.
Absolutely. Any of these signs mean you need to be on the phone with your vet without delay. They signal a different, more urgent kind of problem.
These are the absolute non-negotiables. You see these, you call, no hesitation. It simplifies the decision in a high-stress moment by removing any ambiguity about whether to continue at-home management. It's about recognizing when the problem has escalated beyond your capabilities and needs professional intervention.
Exactly. And looking to the future of breeding practices, Dr. E highlights that modern breeding is rapidly moving beyond guesswork toward precision management of calcium supplementation. Point-of-care blood analyzers are becoming increasingly accessible, allowing breeders to perform real-time monitoring of calcium levels right in your whelping room. This takes a significant amount of the uncertainty out of supplementation decisions, providing hard data.
Wow, actual blood calcium testing at home.
It's becoming a reality. These technological tools, combined with a better understanding of breed-specific risks and individual dam histories, are truly revolutionizing how we approach whelping support, making it more scientific and less reliant on intuition alone.
This is truly where cutting-edge science meets the practical needs of breeders on the ground. Moving from gut feeling and traditional anecdotes to actual data on the whelping floor, that's a game changer. It elevates the level of care we can provide and offers a much clearer, more confident path to intervention, potentially saving more lives. Less guessing, more knowing.
It's all about becoming more precise, more informed. The key, as Dr. E powerfully concludes, is recognizing that calcium is just one tool in your comprehensive whelping toolkit. It is emphatically not the universal solution to every whelping challenge. By truly understanding when to use it, when to carefully avoid it, and crucially, when to seek immediate professional help, you're positioning yourself as the kind of exceptional breeder who makes informed, science-based decisions rather than simply adhering to tradition.
If we connect this to the bigger picture, what truly stands out to me from this deep dive into Dr. E's blog is the immense power of understanding when to use calcium, and even more importantly, when not to. It's not just about giving a supplement, it's about supporting her natural system, knowing the right product for the specific moment, and internalizing those critical 45 minutes that can absolutely save lives. This newfound knowledge empowers us to move beyond old habits and truly provide the best, most precise care for our dams and their puppies. It's about demonstrating expertise, isn't it? Being the kind of breeder who confidently makes informed decisions based on the latest science rather than just following tradition, no matter how deeply ingrained. That feels like progress.
Well said. And for the full protocol, the detailed tables, and even more breeder-ready tools, be sure to read Dr. E's complete article and explore the Breeder Vault. You'll find a link conveniently located in the show notes. So what does this all mean for you? Perhaps the greatest revolution in whelping management isn't a new drug or a fancy piece of equipment, but simply the courage to question our deepest-held traditions and to wholeheartedly embrace the powerful science that empowers us to do better. Your bitches deserve this elevated level of informed care, and now you have the knowledge to confidently provide it.